I am Dr. Sanjeev Kumar. I am consultant neurosurgeon working at Chandanagar branch of Medicover hospital. Today I will be speaking about the topic stroke. A stroke, it is also called as a brain attack. Why public need to be aware about it is also a medical and surgical emergency. So it is more or less identical to the heart attack. So what exactly happens in stroke is the blood flow to a particular area of the brain is cut off. So the oxygen supply and nutrition supply, that part of the brain is completely stopped. So that part of the brain gets permanently damaged. So this is an emergency wherein the patient should seek the medical attention at the earliest. So what are the various factors which can precipitate the events? Somebody is a diabetic, somebody is a hypertensive, or someone is a chronic smoker, or an inactive physical lifestyle, and the obesity. These are the various factors which will facilitate the development of the stroke. So what are the various symptoms what public need to know when to consult the doctor at the earliest? If somebody gets a severe headache or giddiness, a brief period of loss of consciousness, or there is a numbness on one half of the body, or even upper or lower limb, or the weakness of one half of the body, upper or lower limb, or facial deviation, or there is speech impairment in the form of difficulty in the speaking, and there is a swallowing difficulty, or while walking there is a gait imbalance. If any of the symptoms are noticed, the patient should immediately consult the emergency. So wherein the patient will be investigated to find out the reasons. So there are two different types of the stroke, and the treatment protocol for them is completely different. So in 85 to 87% of the cases, it is the ischemic stroke. What exactly happens here is there will be formation of a clot within the arteries which supply the brain. So blood supply is completely cut off here, and the other variety is where the arteries themselves will rupture and there will be bleeding within the brain. So the management protocol for both of them is completely different. Can stroke be prevented? Yes, in 80% of the cases it can be prevented. If a patient is, let's say, diabetic or hypertensive, they should be strictly controlled as per the protocol. If somebody is overweight, they have to reduce their weight. If somebody is a smoker, they have to quit the smoking. And the diet also plays an important role, wherein they have to have a balanced nutrition of the diet and physical activity. It is a mandate. So what are the treatment options that are available for the stroke? In case of the ischemic stroke, where the arteries are blocked, usually the first there is a thrombolysis, wherein the clot is broken down with the medications. This facility is available for those patients who arrive at the hospital within 6 to 8 hours of onset of their symptoms. Once that is done, and the MRI will let us know about which artery is exactly blocked, and in up to 24 hours, in selected group of patients, there is an opportunity to undergo endovascular, wherein a catheter is passed into the artery and the clot can be retrieved. So wherein the blood flow will be established at the earliest, and the recovery, the subsequent morbidity, mortality. In a sense, the chances of death and even the various deficits one develops due to the stroke, they can be reduced. Whereas in case of the hemorrhagic stroke, where there is a bleeding inside within the brain area, so here there are criteria when to operate. The size of the blood clot and its location. On that basis, the patient may have to undergo a surgical intervention where the hemorrhage or the large clot within the brain parenchyma that has to be removed surgically, and the another option is endoscopic procedure is also available for them. So what other measures once the treatment is over at the hospital the patient has to take care? So these patients usually will have some kind of a disability, weakness of the extremities or speech impairment. So for that they may have to undergo a prolonged rehabilitation.